Thank you, Mr. Chair and committee members, for the opportunity to share my story. My name is Lisa Hudson. I'm a lifelong Californian, and I strongly oppose SB 58 as currently written. To be clear, the bill now includes a framework for therapeutic use, which is good, but would also immediately decriminalize these substances for personal use with no safeguards, no protections of any kind. I have personally experienced the devastating consequences of psilocybin and believe it would be dangerous and irresponsible to allow their unregulated recreational and widespread use. My sparkly 16-year-old son, Shane Rebetoy, tragically lost his life in a mushroom-related accidental fall in our home in January of 2020. Shane was a vibrant and ambitious young man with a bright future ahead of him, but his experimentation with psychedelic drugs led to his untimely death. The grief and sorrow of losing my only child will stay with me forever, and I want to prevent other parents from experiencing the same pain. Proponents of SB 58 argue that legalizing psychedelics can treat mental health issues or promote spiritual growth. However, these powerful substances can cause severe hallucinations, delusions, and disorientation, leading to accidents and fatalities. These real risks must be mitigated with safeguards. Moreover, legislation changes how youth perceive the risks related to drug use, normalizing drug use and suggesting that it's acceptable and harmless. We must discourage young people from experimenting with dangerous substances. In conclusion, I urge you to vote against SB 58 unless amended to include safeguards like education, public information, and first response training. We cannot afford to take such risks with people's lives, especially when consequences can be devastating. Thank you for your attention to this matter.
Assembly members, my name is Susan Segee, and I am new to legislative advocacy and formed the coalition with others as a result of the death of my 21-year-old child after the use of psilocybin. They were a student, a very accomplished aerialist, teaching flying trapeze, and was accepted to the University of California at Davis 2 months after their death. Truly a life cut short. I think they took psilocybin in the hopes of a therapeutic benefit, which is what so much research tells us about psychedelic use. After a severe adverse reaction, my child fell to their death. This is not conjecture on our part. They videoed the entire trip on their iPhone, and we were able to see the adverse reaction that occurred right before their death. Our child was able to buy psilocybin in Oakland, where it is decriminalized. They said to me, it's legal at 21. So being a rules-based person, felt they had to wait till they were 21, and as Lisa pointed out, that was the drug was normalized in Oakland and felt it would be safe to purchase. I've seen the bag, and now you have, where they bought the psilocybin. I can open it up. There was no information. There was no instructions given. The potential for any adverse effects, no recommendations to not do it alone. We get more information when we buy vitamins. The bill now provides for studies to enact a regulatory framework before there is therapeutic or facilitated use, but it does not do that for personal use. This will only make the bill less protective for individual users, particularly young adults and those who are most vulnerable, like veterans, who will use these substances with no support or safety net. We want to see an end to the drug war policies. However, we believe that Californians deserve a safe and responsible policy. And I urge you to take the time and enact the safety and education measures that are being enacted for the facilitated and therapeutic use for personal use. The bill now has a 12-month period in there for this these studies to occur. What's the rush? Take that same 12-month period and protect the consumer who is going to use these drugs instead of rushing them through a process that could harm many. And I'd also like to just point out, for clarification, that in the bill right now, although we haven't seen the current draft of the bill, there appears to be in Section 4I a provision that says the transfer of a substance described in paragraph 1 of subdivision A without financial gain between parties 21 years of age and older, and in the context of therapeutic use, which includes facilitated use or supportive use, shall not be a violation of Section 11352 or any other state and local law. So that may be a loophole that would allow people to have a facilitated use while you were doing this period of study. Again, we haven't seen the redraft of the bill, so I'm just putting that out there as a red flag. Thank you.
Good afternoon, good evening, and thank you for your time. My name is Jennifer Mitchell. I am the Associate Chief of Staff for Research at the San Francisco VA Medical Center, and I'm a professor at UCSF in the Departments of Neurology and Psychiatry. And I also serve the California Department of Justice as a member of the Research Advisory Panel, which is tasked with reviewing all research projects in the state that use DEA Schedule I and Schedule II substances, which includes all of the psychedelics that are listed in the current bill. And I should also probably add that I am a neuroscientist and behavioral pharmacologist, and that for the past 7 years, our group at UCSF has focused on developing psychedelic medicines for mental health indications, most notably MDMA for PTSD. And perhaps in part because of this research and because of the press that it has garnered, I have some concern that the media coverage and therefore the growing public perception of psychedelics has become unrealistically positive and doesn't always paint an accurate picture of the possible harms that psychedelics can sometimes induce. And so I'm here today to share my opinion that state decriminalization of psychedelics for facilitated or medical use and building a framework to support this use should precede decriminalization for personal use. I know that there have been some recent changes to the language in SB 58, and that now, if I understand correctly, decriminalization for personal use would precede decriminalization of psychedelics for facilitated and therapeutic use. Yet facilitated use and the data from facilitated use should come before and thereby inform personal use. It is important to remember that, so far, as we've heard, these compounds have only been shown to be safe and effective for treatment of mental health conditions when administered with facilitation. Also, as someone who works with veterans, I am concerned that decriminalization for personal use prior to decriminalization for facilitated use will likely result in negative consequences for our veterans, who have been very vocal in their desire to access psychedelics to treat their trauma and depression, but who will need to experience these drugs in well-vetted medical settings with the proper staff and training in order to safely experience their full potential. Veterans also typically have contraindications and comorbidities, and so need to be thoroughly screened prior to psychedelic use. If personal use or social use precedes therapeutic use, the negative consequences of social use will undoubtedly impact the future of facilitated therapeutic use. This is precisely what occurred here in the late 60s and early 70s, and we are now 50 years later still trying to recover. Psychedelics are complicated compounds that can induce a state of openness and vulnerability, which, with the right guidance and support, can be transformational and curative. Without the right guidance and support, however, this vulnerability can be incredibly destructive. It is therefore important that we generate a system of psychedelic access that will enable appropriate containment and oversight. Thank you for your time.
I think I echo a lot what your last opposition speaker said. Even though we haven't been able to do formal studies on these substances, we do have anecdotal evidence, case reports, that it can be beneficial in certain instances when we talk about our veterans, when we talk about patients with PTSD, when we talk about patients with depression, especially if traditional medications have failed or not working. I really appreciate the fact in the bill that you have delayed implementation of the treatment until there's more information and study and all of that, and that is definitely what is needed. What concerns me about this bill is when you talk about individual use, the fact that there are no prior studies to determine what's safe, who should take it, how it should be taken before. So we're just kind of opening the gates. And so, I know it's a decriminalization, but for many people, decriminalization in their mind is legalization. It is the state saying this is safe, this is okay to take, and we don't have that information. Even with some of our witnesses here, they talked about some of the harmful side effects. When you look through the analysis, it talks about some of the case reports that have been written and published that demonstrate some of the adverse effects of these same medications that you are proposing to decriminalize. And, one of the first things I talked to you about, and also some of your supporters, is how is this in pregnancy? How does this impact a pregnant woman? How does this have an impact on that fetus, short-term or long-term? And we don't have that information. And so when we talk about decriminalizing it for anyone that's 21 and older, without any barriers, without any safeguards, without any specific, if you have PTSD, if you have depression, if you have this, if you're under the care of a physician, we have none of that. We are literally opening it up and saying, through decriminalization, that this state says that this is safe. And I don't know that information. And I've asked everyone to provide me reports or studies that show that this is safe in pregnancy, that this is safe to the unborn fetus, that we're not going to have a situation where we find with, alcohol. And I always tell my patients there's no safe amount of alcohol, or you have fetal alcohol syndrome, or you either have phenotypic appearance, but now what we're realizing is that a lot of patients who are diagnosed with autism are actually not really autistic, but they have a different type of fetal alcohol spectrum disorder. So I don't have that information. So for me, it's hard for me to support something to open up the floodgates without that knowledge, without those safeguards. And honestly, I feel like you need that study and those safeguards for not just treatment purposes, but also for individual use prior to decriminalization, because for many people, that is legalization, and that is giving the green light that this is safe and okay. But I definitely appreciate you bringing this back, continuing the conversations. I look forward to data in the future that shows who should be given the green light and who should not be given the green light with these kind of medications. So thank you.
Thank you, Mr. Chair, and thank you to the author and the conversations that we have had related to this policy. I also want to thank the, I believe it's mostly the gentleman that showed up today in positive testimony towards the bill and the importance of how they felt in dealing with PTSD and additional trauma. And I want to thank also the witnesses in opposition. I want to align my comments with, I'm sorry, I didn't catch your name,
Jennifer Mitchell.
Jennifer Mitchell, thank you for your comments in terms of what is possible and what we can do moving forward. Specifically, as I was reading the analysis of the bill, item 14. Wait, I lost my item. One moment. Item 12 specifies that implementation related to facilitated and supportive use and related activities is not lawful until such a time as regulatory framework governing the therapeutic use, including facilitated and supported use of, the mescaline, DMT, et cetera, are developed and adopted. So what I heard today is that these potential substances are incredibly helpful in dealing with PTSD. What we currently do not have is a structure in which these substances can be used in a safe manner with individuals that know how to process and treat and support an individual going through that process. What worries me, and I represent mostly the city of Los Angeles, is that while we are dealing with massive issues related to housing and unhoused communities, substance abuse issues, mental health challenges, etc., decriminalizing for personal use while not having all the other safeguards in place does not help my community. I don't know how to respond to law enforcement who will not have the support that they need to ensure that these substances aren't getting into the wrong hands. We have a fentanyl crisis that we're dealing with. We have an unhoused crisis that we're dealing with. We have mental health challenges, substance abuse issues. We have a lot of really big challenges in the state. I don't see a pathway in which we decriminalize before we have the regulatory framework for clinical use and support. And I say that with all due respect and thought about what you're trying to accomplish for those that need additional ways in which to heal. I get that. That's not the issue. The issue is, why don't we work on creating the framework necessary first to ensure that those that are using the substances to heal have that available to them, versus just saying, hey, if you're 21 and over and you have 2 grams of X or 2 grams or 4 ounces of whatever, of mushrooms, you're going to be fine. That still doesn't answer the question as to who's selling it, who's making a profit, and how are these substances getting into the wrong hands potentially. So I will, as I did in previous versions of your bill, not be supporting the policy. And we'll consider your closing remarks as this bill moves forward to appropriations. Thank you.
Anyone else? Okay. Well, first of all, thank you, Senator, for working with us. And I will be supporting the bill today. But I do want to say that, first of all, you got the longest analysis of any bill of the day here. And I think there's a good reason for that. But I, too, even though I'm going to support it today, you took a lot of amendments that I know you weren't thrilled about, and I respect you and I thank you for doing that. I still do harbor personal reservations about exactly what Ms. Carrillo was talking about. As we're looking at we're looking at a guidelines for a therapeutic piece of this, but really nothing for the personal recreational piece of that, or whatever you want to call it. We're calling this decriminalization. And so the decriminalization piece of this is really more the purview of the Public Safety Committee. They've weighed in. That's kind of where we are. I'm looking at this from the public health perspective. I don't know what long-term use in larger amounts is. We know that cannabis, we're seeing some things in cannabis that none of us expected and I'm not thrilled about. For the record, I didn't support Prop 64 because I wanted a medical framework to be in place for a longer period of time, but the voters spoke, and that's where we are. And now we're seeing down the road some challenges with that. So I am going to support this today, but I do agree. I think I would be personally much more comfortable if we had the study done first, and then a framework for around the more recreational use of that. But I'm going to honor conversations we've had with you, move this forward, and ask that you maybe consider this. You've still got to get through appropriations, and you've got 80 people on the assembly floor who are going to be looking at this item as well. So anyway, I thank you, and for that, I'll give you the opportunity to close. Thank you. Others in opposition?
Good evening, Lori Dubin. I'm a parent in Larkspur. I am speaking for these organizations Pueblo y Salud in the San Fernando Valley, Wellify Teen in Marin County, Safe Launch in Santa Barbara, Pacific Cliff and the George Sarlo family in San Francisco, San Rafael Vice Mayor Rachel Kurtz, Sausalito City Council Member Jill Hoffman, and my California nonprofit Be the Influence, all in strong opposition to SB 58. Thank you.
Thank you.
Priscilla Quiros here on behalf of the City of Beverly Hills in respectful opposition.
Thank you.
Beth Parker on behalf of the California Coalition for Psychedelic Safety and Education. We're opposed unless further amended. And also for Youth Transforming Justice out of San Rafael, opposed.
Thank you.
Kelsey Fernandez with Marin Healthy Youth Partnerships, and also a proxy for Lori Robinson, Moms Strong, Thousand Oaks. Thank you.
Okay, thank you.
John Gaffney, Johnny's Ambassadors, parent also of a child who developed cannabis-induced psychosis and psilocybin psychosis, in opposition. Thank you.
Thank you. Okay, bring it back to